everyone, I'm Radhika. I'm student of Sanika College and I'm in the first semester of Chronic Disease Management program. Today I'm going to perform cardiovascular assessment. So first of all, I'll wash my hands and I'll pull curtains to provide privacy to the patient. Then I will assess any risk of PPE. Is patient is alert and oriented, or if there is any signs of distress, if the patient is comfortable, is the patient's behavior is normal. And then I will explain my role to the patient. Hello, I'm Radhika. I'm a nursing student. How are you doing today?
Hi, I'm good.
Okay, so today I'm going to perform cardiovascular assessment on you. It will take 10 to 15 minutes and you have right to decline, and you can ask questions at any time if you will have. And there is a confidentiality agreement that you can stop me at any time, and all the information can be will be kept confidential. Okay? Okay. Okay, next I'll ask some questions related to gather subjective data from the patient. So first of all, I'll ask patient if she has any smoking history. Do you have any smoking history? Do you smoke?
No.
Do you have any allergies?
No.
Are you taking any medications?
No.
Okay, do you do any physical activity?
Yes.
Okay, that's great. Then I'll ask patient if patient has any cardiac related diseases. Do you have any heart disease? Any palpitations? Okay, so also I will ask patient if there is any complaint of chest pain, but before that I'll take patient's vital signs. Then I'll ask patient if she has any chest pain. Do you have any chest pain? Okay, patient states she is not having any chest pain. So if patient is having any chest pain, then I will perform OPQRSTU mnemonic. So according to that, first of all, O stands for onset, when the pain started, when it began, when was the beginning of the pain. And then P stands for any palliative factors. It does mean that is there any factor that provoke pain of the patient. And then Q means the quality. Is it severe, is it sharp pain, or is it low pain? Then R stands for radiating factors. If the pain radiates to any other parts of the body. Then S stands for severity, how severe the pain is. I'll ask patient to rate the pain from 0 to 10 on a pain rating scale, from number 0 to 10. And then T stands for timing, like what time what was the patient doing and what time was it when the pain started. And then U stands for understanding of the pain according to the patient. According to patient, what she understands about the pain, why is it happening, why the pain, like what is the reason behind causing pain. So all these questions I will ask patient to gather my subjective data. Okay, then I'll collect some objective data. For that, I'll take vital signs of the patient. I'll measure the height and weight of the patient. Okay, next step is inspection. So in cardiovascular system, first of all, I will assess patient's general appearance for inspection. If the patient's what is the patient's level of alertness. Then I'll assess patient's behavior. Then I'll note any skin changes. Is there any signs of redness, pallor? If there is any visible veins, and if there is any lower leg ulcers, if there is any lesions, scars on patient's skin. And also I will observe any signs of if there is any palpation, if there is jugular vein distension signs, what is the symmetry, and what is the movement of chest. So all these includes under inspection. Next step is palpation. So for palpation, I'll palpate all of the pulses of the patient's body. So I'll use the pads of my index finger and middle finger. So first of all, there is apical carotid pulse. And for carotid pulse, it's on the side of the neck. So I'll use my pads of my index and middle finger and I'll assess. And I will also explain before doing that to the patient, because maybe my hands will be a little bit cold. So I'm checking your pulsation, so it may be a little bit cold. Is that okay? Okay, then I'll assess patient's radial pulse on the hand, and then patient's brachial pulse, which is on the middle of the forearm. That's fine. I'm going to expose you a little bit if you are comfortable.
Okay.
Then I'll expose patient a little bit and I'll assess femoral pulse. Okay. Then I'll go further down on the feet of the patient. I'll expose a little bit and I'll check dorsalis pedis and tibial pulse. On side of the feet. Okay. So after checking all these pulses, next step is auscultation. Okay, I would auscultate for heart sounds, and if there is any murmur sounds, then I will auscultate at five areas of five regions of the heart, which is called aortic, pulmonic, tricuspid, orbs, and last one is mitral. So I would ask patient to sit. Are you able to sit for a bit?
Yes.
Okay, thank you. So first of all, I would auscultate aortic. So aortic valve is on the right side of the body at second intercostal space. So I would auscultate it with the diaphragm. So this is rib, first intercostal and second intercostal space, and down straight to that there is pulmonic valve on the second intercostal space on the left side, and on the third intercostal space there is Erb's point. On fourth intercostal space there is tricuspid valve. Then in the mid-clavicular line, straight across, and in the fifth intercostal space there is mitral valve. So after that I can repeat auscultation further if I need for auscultating for any murmur sounds. Last part includes documentation, in which I'll document according to S bar. So first of all, S stands for situation, which includes documentation of name, age, gender and chief complaints of the patient. And then next is background, which includes any history related questions and the questions that I asked in subjective data from the patient. Then next is assessment. That I would assess all the findings, that includes inspection, palpation and auscultation assessment. Last one is recommendation. If the patient needs further assessment, I would recommend patient to see an MG or physician, and I will document if I would provide any comfortable measures to the patient. Thank you.